Assalamu alaikum. In this video I am going to demonstrate Mirena. That is a long-acting intrauterine hormone releasing contraceptive system, its uses and its procedure of insertion. Mirena is actually a long-acting intrauterine system which contains 52 mg of levonorgestrel, and it releases 20 microgram per day of levonorgestrel in the uterine cavity. It is used for contraceptive purpose for 5 years, menorrhagia, dysmenorrhea, premenstrual syndrome, and it prevents endometrial hyperplasia in women taking hormone replacement therapy or patient with PCOS. Now going towards the requirements or prerequisites and how to set the trolley for Mirena insertion. You should have obviously a Mirena, a cusco speculum, bivalve cusco speculum. This is uterine sound. It is a sponge holding forceps containing the sponge to clean the vagina prior to the procedure. It's a valsalum. You can also use tenaculum. These are different sizes of Hager's dilator, and this is Caesar. Now I'm going to demonstrate the procedure of Mirena insertion. Introduce yourself to the patient and to the couple and make sure that there is a legitimate indication for Mirena insertion. I will make sure that there is no contraindication to the procedure, and after taking medical and gynecological history, I will explain the whole procedure and take informed consent from the couple. Make sure that the equipments are ready and check the expiry date of the Mirena. Ask the patient to empty her bladder and ask her to lie in the couch in dorsal position. Then after wearing gloves, do a bimanual examination to check for the uterine position and its mobility. Then clean the area with any antiseptic solution. Insert a cusco speculum to visualize the cervix and fix it so that you can properly visualize the cervix. Then hold the anterior lip of the cervix with tenaculum or a valsalum. By holding anterior lip of the cervix and giving it a gentle traction, you will straighten the uterine cavity so that the procedure is easy for you. I will further demonstrate the procedure on this model. Hold the anterior lip of the cervix with the tenaculum. Then pass a uterine sound to assess the size of the uterine cavity. According to this, it's 6 cm on the uterine sound. Then ask your attendant to open the packing of the Mirena. Now going towards the Mirena, first of all I will explain the parts of the Mirena. These are flange that contain levonorgestrel. This is flange. This is slider, and this is the whole stem that contains the Mirena. Now first of all, you have to check that the flange are in horizontal position and the instrument is in upright position and the centimeter mark is towards you. Now you have to push the slider up so that the flange are loaded. Now this is the loaded position. Now match this flange with the uterine sound so that it can be according to the uterine size. Now it's 6 cm and I have fixed the flange with this 6 cm. As I have already applied the valsalum, I just pull the anterior lip slightly towards me and introduce I will introduce the Mirena. When the flange is 1.5 to 2 cm away from the external os, don't move it further. Then pull the slider back till the mark. It will unload the Mirena and the flange get open slightly. Then wait for 5 seconds and push the Mirena forward so that it can touches the fundus. Then pull the slider all the way downward so that it can get unloaded. Gently pull the Mirena. Then cut the thread 1.5 centimeter or 2 centimeter away from the external os so that it can be checked afterward.